The Edo State Commissioner for Health, Dr. Siri Adams Oshiomhole, received a delegation from the Medical Rehabilitation Therapist Board of Nigeria during a courtesy visit aimed at strengthening rehabilitation services in the state. The visit focused on the presentation of the World Health Organization's Rehabilitation 2030 initiative, which the Federal Ministry of Health has directed to be implemented across Nigeria. The delegation was led by the Registrar of the Board, Professor Rufai Yusuf Ahmed, who explained that a technical working group has been inaugurated by the Minister of Health to guide the country through the process of integrating rehabilitation into the wider health system.
The Coordinating Minister of Health has inaugurated the Rehabilitation Technical Working Group that is saddled with the responsibility of assisting the Nigerian government to implement go through the processes of implementation of the agenda. The WHO has given us a technical officer, has signed a technical officer to help Nigeria to do that implementation. And what the initiative is all about is about integrating rehabilitation into universal health coverage, looking at the 6 building blocks of the health system. So leadership and governance, service delivery, the workforce, health finance, rehabilitation financing, data and information, and assistive technology. And so the 4 phases of the implementation are the situation analysis. There are templates that the WHO has given us, which we are going around the state to seek for support from the states through the commissioners to ensure that the data collection is holistic across the country. And then after the data collection, we are going to now come up with a national rehabilitation policy alongside a strategic plan that is going to help Nigeria to implement the agenda. There's also going to be a monitoring and evaluation framework. And then after that, all that will now be put in perspective and the implementation.
Dr. Oshiomhole, while welcoming the team, expressed appreciation for their efforts and promised to give full support to ensure that the program is properly implemented in Edo State. He also used the opportunity to inform the stakeholders about plans to mark World Autism Day as part of efforts to raise awareness and strengthen rehabilitation services across the state. Director of Occupational Therapy at Edo Specialist Hospital, Dr. Victoria Mu, highlighted the need to expand rehabilitation services beyond hospitals. She emphasized the importance of including rehabilitation in primary health care centers, schools that cater for children with disabilities, and facilities that provide support to people with mental health conditions.
The Commissioner is a progressive. I'm proud to associate with him. He was very open-minded about it, and he gave us some key points and gave us a pathway in which to accomplish this project. So we are excited because rehabilitation is a household name, and it should be a household name because between children with disability, between adults with disorders, between the state with a lot of mental health patients around, rehabilitation should be the cornerstone of Edo State.
Edo State is among states selected for the implementation of the rehabilitation project. Others include Jigawa, Gombe, Enugu, and Oyo. The meeting was part of ongoing stakeholders' engagement to support the successful rollout of the initiative and ensure that more people have access to needed rehabilitation services. Irene Ejoba, reporting.